Raphella, when she first came to us, I think she was maybe newly houseless for a couple of months. And prior to that, she was working full-time, had her own place and things like that. But certain situations happened where she was houseless. She came to our clinic needing help and services as far as like her pregnancy and getting established with a primary care doctor, or even trying to identify where to start. So for us, she wasn't only being seen for the medical part, but she was really needing the patient advocacy, so the social supports, aligning her with certain providers and even assisting with insurance. She actually heard her baby's heartbeat for the first time at one of our clinics. And I think for her, like, she was just so excited. So I'm born in San Narciso, Zambales, and my family and I, we immigrated here back in 1992. Us arriving here and settling here is a huge part of why I do what I do. So for me, I grew up going to health centers. I grew up going to free clinics. At one point, we didn't have a home either, but my mom made a way. And I see that similar strength in Raphella, like she's making a way for herself and for her baby. Thinking about like her process, and the things that she had to go through and what we did together as far as getting her care and getting her connected. And then also just knowing where she is now. So now she has a full-time job. She's about to have her baby. She has the support that she needs, and hopefully she can get into an apartment, I just like knowing the things that she has gone through and kind of seeing things to fruition now. It's inspiring. I think for me, like, that's why I get emotional. It's because like I see where you were and the journey that you're on and where you are now. And to be a part of that, to witness that, I think it's a privilege.
So the fact that you gave birth just like a couple weeks ago, and most people be like, what are you doing? You should be resting and stuff, but you really wanted to be here to have this time to talk about Home Project because it means so much to you. Why does Home Project mean so much to you?
I've had a lot of colorful experiences, I guess, with healthcare people. So just having like students come and people come to just see us and help us, it feels good to finally have people look at me not as what my circumstances are or have been, but what they're going to be. Because I'm not gonna be that person that's gonna just be in Chinatown, that doesn't have care, who's pregnant, who's just running around just being nobody. Like I am somebody, I'm a mother, and I'm not gonna be this way forever. So it's just good to kind of have people look at me and say, okay, well, she was there, but look at her now. Having people like the Home Project, it's just helpful because it makes you feel like a human being, and it's like they need to keep doing this, like to have these medical students have experience with people like us before they go to Queens or to the women's hospital, so that they could like not be so shocked by maybe somebody who's homeless and pregnant or somebody who has mental health and drug history, and they can kind of approach them with like a compassion because they've been, working with the Home Project prior,
I want to let you get back to your baby.
Thank
but
you.
Congratulations, we're really excited for you, and
Thanks.
all the best in the future for you.
Thank you.